Welcome to the 50-year celebrations of the American Journal of Sports Medicine. We are featuring top cited articles in the last 50 years. My name is Ziad Dahabre. I'm an electronic media editorial board member, and I'd like to welcome on behalf of the board, Dr. Gordon Matheson. Dr. Matheson's research titled Stress Fractures in Athletes, a study of 320 cases, was top cited in 1987. Congratulations on being a top cited author, Dr. Matheson, and thanks a lot for joining us. Dr. Matheson, what was the reason for initiating this study?
Yeah, in 1987 and before, stress fractures were an uncommonly recognized entity. What had taken place in the 10 or 20 years prior to that was this awareness of exercise and health and how important physical activity was. So really the entire society had started shifting toward running, for example. But stress fractures were uncommonly recognized. Shin splints was a term that had existed, but I remember early in practice, a patient coming in who had the pain in the anterior part of the tibia, a bone scan done. They assumed it was some form of cancer and they biopsied it. So stress fractures were not well known. And I was part of a clinic at the University of British Columbia, the Alan McGavin Clinic, where runners from all over British Columbia came. And so we saw tons and tons of cases. We were known as the clinic for people to come. So our goal was to try to understand them and get more information out about stress fractures. And of course, nowadays, stress fractures are a well-known entity.
Oh, that's interesting. That brings me to my second question, actually. And that kind of answers it in a way. How difficult was it to conduct such a large study on an entity that's relatively infrequent in occurrence?
It's a good question. Because the clinic was on the university campus, it was an academic clinic, we kept meticulous records when patients came in. The history was, followed a format. The physical examination followed a format, follow-up visits, the investigations done, things like measuring alignment of the lower extremity, the foot and ankle, and so forth. So that data was in every single chart. We had a very primitive computer-based sort of database at the time. So I was able to pull out all those with the diagnosis and go through the charts and then do the follow-up. So it took a lot of work, but it's straightforward to find that many cases.
Cool. And I know it's been quite a few years since your publication and things have obviously moved on. And you have yourself published more on the topic, but have your recommendations changed in terms of regarding a bone scan as an excellent diagnostic tool? Do you think MRI should be used more nowadays, or are there rules for each modality in certain situations?
Well, the simple answer to that, from my perspective, is the bone scan is extremely sensitive. It doesn't miss anything. The triple phase bone scan, but it's not very specific. The CT scan, very specific, but you've got to know exactly where you're doing the cuts. And MRI is somewhere in between. And the reason MRI is somewhere in between is it's very sensitive, but really the power of the magnet interrogates molecules in solution. So there has to be edema. It's not as good in imaging bone without edema, but most stress fractures, by the time they're imaged, have edema. So I think the MRI is the general tool. It gives information in multiple areas, unlike CT, which is focused. I don't know many people doing bone scans anymore, to be honest.
Yeah, likewise. That's why I was wondering if that still probably has a role in certain cases. And in terms of this distribution patterns between athletes and military recruits, do you believe it's changed over the years in terms of comparing military recruits with athletes in terms of the distribution of stress fractures?
It's another good question. I'm not entirely sure. The thing about the military is it is so defined and programmed. They know exactly what they are prescribing in terms of exercise. And some of the issues like having short females keep the same stride length as a tall male, once it was found that that was a cause of pelvic and femoral stress fractures, those regimes have been changed. So my feeling is stress fracture has gone down, but I'm not on top of that literature in the military. I think competitive athletes in track and field are very aware of stress fracture, and so they train very, very close to I'd say a threshold that could produce a stress fracture. We aren't as worried about some stress fractures. Obviously, more worried about, say, the navicular or the femur than you are about a metatarsal, just because the risk of fracture is and complication is lower. But I really think in military the rate's gone down. In the track community and the running community, they push the limit in terms of training. I don't think that the rate or the incidence has gone down.
Mm-hmm. Interesting. And do you have any advice for future researchers looking into studying stress fractures?
The only advice would be we still tend to think of a fracture as a discrete single off event rather than a spectrum or a range of metabolic adaptations to load. So it's worthwhile in teaching about stress fracture to understand the factors that lead to the contributions to stress fracture in terms of rate, pace, alignment, and so forth, because it's just subtle changes that can prevent stress fractures. And then the same thing goes in terms of how severe the stress fracture is. It's important to recognize that the bone is constantly remodeling, then it goes to accelerated remodeling, then microfractures, then fractures. And understanding it as a spectrum is important in terms of treating. As far as research goes, I can't think of any one particular topic. There've been so many things from, medications to electromagnetic treatment. The one basic thing is we tend not to immobilize stress fractures.
Mm-hmm. Cool. That's really good. It's been really interesting talking to you, Dr. Matheson. And thanks a lot again for joining us.
You're welcome.
Yeah, great. And happy 50th AJSM.
Yeah, right, exactly. Happy 50th.
Thanks a lot.
Thank you.